speaking at a mid-year meeting to review the performance of the region for the first half of the year and deliberate on how to improve the region's general healthcare delivery. The Bono East Regional Director of Health Services, Dr. Fred Admarko-Boateng, said the region is working towards achieving its COVID-19 vaccination target of 85% single dose and 70% fully vaccinated as a means of curbing the spread of the pandemic across the region.
Currently, with 835,086 eligible population for the vaccines, 433,781, that is 51, almost 52%, have been vaccinated with a dose. And 326,032, that is 39%, are fully vaccinated. Mr. Chair, the question that we have been asking ourselves, how do we reach the target of 85% single dose for Bono East? And how do we also achieve 70% fully vaccinated? Because you can see from all the figures that we are discussing that the game changer over here is the vaccination exercise, among other things. And therefore, looking at the nature of Bono East, there is nothing that we can do in a quest to overcome this COVID without actually increasing the uptake.
Dr. Fred Admarko-Boateng is optimistic that with the numerous challenges facing the region in terms of logistics and resources, a wider COVID vaccination coverage will help protect the region's workforce.
You know the challenges that we are having as a newly created region. We are less endowed in terms of equity, infrastructure, human resources. We are lacking. Even within Bono East, we are having that challenge. So the low-hanging fruit that we can really address is the having higher coverage for the COVID-19 vaccines. If we're able to do that, then it means that should we have any wave or surge, then we are well protected.
Chairman of the occasion and director of the Kintampo Health Research Center, Dr. Kwaku Poku Asante, on his part expressed concern with the increase in the number of hypertensive cases in the region and people's reluctance to visit the hospitals for care.
At the research center, Kintampo Health Research Center of the Ghana Health Service, we have identified that within the community there are about 25% of people with hypertension. That is, every 1 out of 4 adults would have hypertension. But unfortunately, we are not seeing them in the hospitals. And this is because hypertension is a silent killer. Diabetes is a silent killer. If we do not screen early enough to identify them when they have not developed complications, they will now end up in the hospitals with complications. And some of them would die. I mean, hypertension, you can just die off like that with a stroke or a heart attack. Once we do that, we'll be making a huge impact on non-communicable diseases, specifically hypertension and diabetes.
The 2022 mid-year review, according to Dr. Fred Admarko-Boateng, is geared towards improving quality healthcare delivery rather than the number of visitations to the various health centers in the area. Anna Sabet, Joy News, Kintampo.